If you're over 65, you probably enjoy a good piece of fruit now and then. But not all fruits are as healthy as they seem. Some can quietly raise your sugar, worsen joint pain, and leave you feeling tired. Let's talk about 4 fruits to avoid, and 4 that truly help you feel better. Subscribe for more honest, simple tips to stay strong and sharp after 60. Your health deserves this care. Grapes. Grapes may look harmless, but for adults over 65, they can quietly create serious health imbalances. These small, juicy fruits are surprisingly high in natural sugars and very low in fiber. That combination makes them particularly risky for older adults who are trying to manage their blood sugar levels, weight, or energy stability throughout the day. Despite being a whole fruit, grapes can raise blood glucose almost as quickly as candy, especially when eaten in larger amounts, which is easy to do since they're small, bite-sized, and often consumed mindlessly by the handful. Some doctors warn that this type of sugar spike is especially dangerous for seniors whose insulin response has already slowed with age. The sudden rush of sugar into the bloodstream may lead to a quick burst of energy, followed by a steep crash. Over time, repeated blood sugar surges can contribute to insulin resistance, increased fatigue, and a higher risk of developing type 2 diabetes, even in people who were previously only borderline. Grapes do not offer enough fiber to slow the absorption of sugar in the digestive system, which is why their impact can feel so immediate and dramatic, especially in sensitive or aging bodies. Beyond blood sugar, grapes can also impact weight management in older adults. Even a small bowl can deliver over 20 grams of sugar with minimal satiety, meaning it doesn't keep you full or satisfied. For seniors already dealing with slowed metabolism or limited mobility, these hidden sugars can contribute to gradual weight gain, which may place added stress on joints, increase inflammation, or worsen heart health over time. Some studies have even linked frequent consumption of high-sugar fruits with elevated triglyceride levels, a known risk factor for cardiovascular disease. Another overlooked issue is that grapes, while sweet and convenient, often displace more nutrient-dense food choices. A senior reaching for a handful of grapes several times a day might skip fruits that offer more fiber, antioxidants, or benefits for digestion and memory. And while grapes do contain small amounts of vitamins and antioxidants, their high sugar-to-fiber ratio makes them less ideal compared to other fruits that support long-term health more reliably. Doctors sometimes recommend avoiding fruits like grapes entirely for those on diabetic or pre-diabetic diets, particularly if blood sugar control is a priority. For those over 65, the body's ability to buffer dietary stressors is reduced. That makes choices like these, fruits that seem innocent but act like sugar bombs, all the more important to recognize. Grapes may feel natural and refreshing, but they can quietly sabotage energy, sleep, and heart health in aging adults. Watermelon. Watermelon is often seen as the perfect summer fruit, cooling, juicy, and easy to enjoy in large portions. But for seniors, especially those concerned with blood sugar or energy stability, watermelon can pose hidden risks that are easy to overlook. The glycemic index of watermelon is one of the highest among all fruits. This means that the natural sugar in watermelon is absorbed very quickly into the bloodstream, causing a rapid spike in insulin levels. Some doctors compare its effect to eating refined carbohydrates, noting that its sweetness and high water content can mask how fast it's impacting the body. When blood sugar rises suddenly, the body responds with a surge of insulin to bring it down. For people over 65, this insulin response may be slower or less efficient than it once was, which can create a sharp peak followed by a noticeable crash in energy. That crash may leave someone feeling weak, irritable, or tired, not long after, feeling refreshed. These ups and downs can be especially hard on seniors who are trying to keep their energy steady for daily tasks, exercise, or mental focus. Over time, these repeated insulin surges may wear down the body's natural ability to regulate blood sugar, potentially contributing to insulin resistance and metabolic issues. Several nutrition experts caution that while watermelon is low in calories, it's not low in sugar. A typical wedge contains more than 17 grams of sugar, and because watermelon is so hydrating and light, It's very easy to eat more than one serving without realizing it. Unlike fruits that provide fiber or fat to slow digestion, watermelon enters the system quickly and with little resistance. That fast absorption may increase the risk of sugar-related inflammation in joints, lead to temporary dizziness in some sensitive individuals, or disrupt sleep when eaten late in the day. In studies involving older adults, high glycemic fruits, like watermelon, have been linked with less favorable blood glucose outcomes compared to low glycemic options. Doctors often suggest avoiding such fruits for patients managing prediabetes or diabetes, especially if their diet already contains other sources of sugar. Even for seniors without a formal diagnosis, the long-term effects of regular blood sugar spikes can include increased fatigue, mental fog, and higher stress on the cardiovascular system. Watermelon may look innocent, but for aging bodies, it can act like a sugar bomb in disguise. It hits the system hard and fast, much like a summer storm that arrives out of nowhere. And while the sweetness fades quickly, the metabolic effects can linger long after the last bite. Mango. Mango is often thought of as nature's dessert, soft, fragrant, and intensely sweet. But for adults over 65, this tropical fruit can become more of a health hazard than a healthy treat. Mangoes are unusually high in both natural sugars and fast-digesting carbohydrates, making them one of the worst fruits for seniors trying to maintain stable blood sugar levels. Just one medium-sized mango can contain over 45 grams of sugar, more than what's found in some candy bars. That amount, when consumed in a short period, can overwhelm the body's ability to manage glucose effectively, especially in older adults whose insulin sensitivity has declined with age. Some doctors caution that mangoes, despite being rich in vitamins, can easily trigger blood sugar spikes in seniors with prediabetes, diabetes, or metabolic syndrome. These spikes aren't always noticeable right away, but they can lead to fatigue, blurry vision, and even mood changes within hours. When consumed regularly, mango's high sugar load can place added strain on the pancreas, forcing it to work harder to release insulin. Over time, this can worsen insulin resistance and make blood sugar control more difficult, even in seniors, who are otherwise careful with their diets. In addition to affecting glucose, mango may also contribute to chronic inflammation in older adults. Excessive sugar intake is known to fuel inflammatory pathways in the body, which can aggravate conditions such as arthritis, joint pain, or cardiovascular disease, problems that already tend to increase with age. Some studies have shown that high-sugar fruits like mango may also worsen non-alcoholic fatty liver disease, a condition that becomes more common after 60. In these cases, sugar from fruit doesn't get burned off for energy, but instead gets stored as fat in the liver, slowly contributing to long-term organ stress. What makes mango even more problematic is how easy it is to eat too much of it. The soft texture and bold sweetness make portion control difficult, especially when it's blended into smoothies, added to desserts, or eaten straight from the bowl in warm weather. Without the fiber or fat to slow down absorption, mango's sugar rush can hit the bloodstream rapidly, making it one of the more dangerous fruits for anyone trying to manage energy, weight, or chronic inflammation. Mango might taste like a tropical vacation, but for the aging body, it's more like a sticky trap. Sweet today, swelling tomorrow. That's the silent trade-off many seniors face when they enjoy this fruit without knowing its deeper effects. Canned fruit in syrup. Canned fruit in syrup is one of the most misleading foods on store shelves. While it's marketed as a convenient source of fruit, the reality is far from healthy. For seniors over 65, especially those managing blood sugar, heart health, or inflammation, this type of processed fruit can be especially harmful. The fruit itself has often been peeled, heated, and stored for months, which removes much of its natural fiber and weakens its nutritional value. What's left is then soaked in heavy syrup, essentially a concentrated sugar solution that floods the body with glucose far more quickly than fresh fruit ever could. Some doctors warn that syrup-packed fruits are a hidden danger for older adults because they bypass the natural checks and balances that whole fruits provide. When fiber is stripped away, sugar absorption speeds up dramatically. This can lead to immediate insulin spikes, causing blood sugar levels to rise sharply and then crash, resulting in fatigue, hunger, or mood swings. These fluctuations are not only uncomfortable, but also dangerous over time. Repeated sugar surges have been linked to worsening insulin resistance, a condition that becomes more common with age and increases the risk of type 2 diabetes. In addition to affecting blood sugar, the syrup in canned fruits fuels low-grade inflammation throughout the body. Research has shown that diets high in added sugars contribute to the release of inflammatory cytokines, molecules that play a role in joint pain, stiffness, and even cognitive decline. For seniors already dealing with arthritis, heart conditions, or memory issues, this added inflammatory burden can quietly make things worse. The problem isn't just the sugar, it's the way it's delivered, quickly, heavily, and without any buffering from fiber or nutrients. Even the fruit itself suffers. In the canning process, once it's submerged in syrup, the remaining vitamins begin to degrade. Heat and storage time further reduce vitamin C and other antioxidants, leaving behind a sweet-tasting shell that does more harm than good. The end result is a product that resembles fruit, but acts more like dessert, except it's often consumed in larger amounts because it's assumed to be healthy. What makes this especially dangerous is how normalized canned fruit has become in senior diets. It's easy to serve, often included in care facilities or hospital meals, and promoted as a nutritious option, but under the label, it's dessert, pretending to be healthy. And while it may satisfy a sweet tooth, the body knows the difference. Cells exposed to repeated sugar overload begin to lose sensitivity to insulin, store more fat, and show signs of oxidative stress, changes that accelerate aging from the inside out. The sweetness might be appealing, but the long-term price is paid in energy, mobility, and health. Berries, especially blueberries and raspberries, are among the best fruits seniors can include in their diets. These tiny jewels are low in sugar, which makes them excellent for blood sugar control, a key concern for those over 65. Unlike many other fruits, blueberries and raspberries have a high fiber content, which slows digestion and helps prevent the rapid blood sugar spikes that can disrupt energy and mood. This fiber also supports digestive health, which tends to decline with age, promoting regularity and reducing the risk of constipation. Research has shown that these berries are packed with antioxidants, compounds that protect cells from damage caused by harmful molecules called free radicals. Free radicals accumulate naturally as we age and contribute to many chronic diseases, including heart disease, cancer, and cognitive decline. Studies have found that regular consumption of blueberries and raspberries can help reduce oxidative stress, which supports healthier aging at the cellular level. Blueberries and raspberries also contain special brain-protecting compounds called flavonoids. Some doctors and scientists emphasize their role in improving memory and cognitive function in older adults. These flavonoids increase blood flow to the brain and may promote the growth of new brain cells, helping to maintain sharpness and mental clarity. Several clinical trials have linked berry intake with improvements in short-term memory, attention, and even mood, which can all decline with age. Heart health is another area where these berries provide real benefits. High blood pressure and arterial stiffness become more common with age, increasing the risk of stroke and heart attack. The antioxidants and anti-inflammatory properties in blueberries and raspberries help relax blood vessels and improve circulation. Some studies suggest that eating berries regularly may modestly lower blood pressure and reduce harmful LDL cholesterol levels, both critical factors in preventing cardiovascular disease. Because they are low in calories yet nutrient-dense, berries fit well into weight management efforts, a common challenge for seniors trying to stay active and healthy. The natural sweetness of blueberries and raspberries satisfies cravings without overloading the body with sugar, making them a perfect snack or addition to meals. Their versatility allows them to be enjoyed fresh, frozen, or even added to oatmeal or yogurt, making it easy to incorporate them into a daily routine. Kiwi. Kiwi is a remarkable fruit for seniors, packed with vitamin C, potassium, and fiber, all essential nutrients that support several key aspects of health after 65. Vitamin C, found abundantly in kiwi, plays a critical role in maintaining a strong immune system, which naturally weakens with age. Some doctors emphasize that adequate vitamin C intake helps the body fend off infections and recover more quickly, a vital benefit for older adults who may face more frequent illnesses. The antioxidant properties of vitamin C also protect cells from damage, reducing inflammation and supporting healthy skin and tissues. Potassium is another important nutrient in kiwi, crucial for regulating blood pressure and maintaining proper heart function. As people age, controlling blood pressure becomes more challenging, but also more important to prevent stroke and heart disease. Research indicates that a potassium-rich diet, including fruits like kiwi, helps balance sodium levels and relaxes blood vessels, contributing to better cardiovascular health. For seniors, this can translate to fewer medications and better quality of life. Kiwi's high fiber content supports digestive health, which often slows down with age, leading to issues like constipation and discomfort. The fiber in kiwi aids in regular bowel movements and nourishes beneficial gut bacteria, improving overall digestion. Some studies have even shown that kiwi can help reduce bloating and promote a healthier gut environment, which is linked to improved nutrient absorption and immune function. For seniors, a healthy gut means better energy and fewer digestive problems. Another often overlooked benefit of kiwi is its positive effect on eye health. It contains lutein and zeaxanthin, antioxidants that protect the eyes from age-related macular degeneration and cataracts, common concerns in older adults. Doctors advise incorporating foods rich in these compounds to help maintain vision clarity and reduce the risk of eye diseases. Despite being sweet and flavorful, kiwi is low in sugar, making it a safe fruit choice for seniors managing blood sugar levels or diabetes. Its natural sweetness satisfies cravings without causing spikes in insulin or energy crashes, unlike many other fruits that are high in sugars. This makes kiwi an excellent, gentle option for snacks or additions to meals. Soft, sweet, and gentle. On the gut, kiwi is truly a fruit that knows exactly what an older body needs. It nourishes the immune system, supports the heart and digestion, and protects vision, all while delivering a delicious and low-sugar treat. Including kiwi in the EEE diet can be a simple yet powerful way for seniors to support their health and well-being every day. Pomegranate. Pomegranate is a powerful fruit for seniors, known for its ability to support blood pressure, circulation, and joint health. This fruit is rich in antioxidants, polyphenols, and anti-inflammatory compounds, all of which play important roles in maintaining overall well-being after 65. Many doctors recommend pomegranate because its natural compounds help relax blood vessels and improve blood flow, which can reduce high blood pressure, a common issue in older adults that increases the risk of heart attack and stroke. Improved circulation means oxygen and nutrients reach the body's tissues more effectively, supporting energy and organ function. The antioxidants in pomegranate combat free radicals, which are unstable molecules that damage cells and contribute to aging and chronic diseases. Research has shown that regular consumption of pomegranate juice or seeds can lower oxidative stress, reducing inflammation and protecting the cardiovascular system. This anti-inflammatory effect also benefits joint health by easing stiffness and discomfort associated with arthritis, which affects many seniors. Studies have found that pomegranate extract may slow cartilage breakdown and promote joint mobility, making daily movement easier and less painful. Pomegranate contains polyphenols, which are plant compounds with strong health-promoting properties. These polyphenols act as natural defenders against inflammation and oxidative damage. Some doctors highlight how these compounds help support healthy blood vessels and reduce the risk of plaque buildup, improving heart health and reducing the chances of cardiovascular disease. For seniors, this means better heart function and a lower risk of complications related to poor circulation. Each seed of the pomegranate acts like a little soldier fighting for vitality by delivering these protective nutrients directly to the body. Consuming pomegranate regularly can lead to noticeable improvements in energy and well-being, partly because better blood flow supports brain health, muscle function, and overall stamina. The fruit's natural sweetness also makes it an enjoyable addition to the diet, without the high sugar content found in many other fruits. which can spike blood sugar and cause unwanted energy crashes. Incorporating pomegranate into the daily routine is a simple way for seniors to support their heart, joints, and circulation naturally. The rich antioxidants and anti-inflammatory compounds work behind the scenes to keep the body functioning smoothly and protect against common age-related health issues. This fruit's unique blend of nutrients makes it a valuable ally in maintaining vitality and quality of life well into the golden years. Apples. Apples are a fantastic choice for seniors because they are rich in fiber, which supports a healthy gut and improves digestion. The soluble fiber in apples helps slow down the digestion process, leading to more stable blood sugar levels, a crucial factor for those over 65 managing their energy and reducing the risk of diabetes. Some doctors emphasize that stable blood sugar helps maintain steady energy throughout the day and prevents the spikes and crashes that can leave seniors feeling tired and irritable. Eating the whole apple, especially with the skin on, is essential to gain the full health benefits. The skin contains powerful plant compounds called polyphenols, which have antioxidant properties that protect cells from damage caused by free radicals. Research suggests these antioxidants may also reduce inflammation and support heart health, two important concerns for older adults. The skin's nutrients contribute to strengthening the immune system, which naturally weakens with age. This means that apples not only nourish the body, but also help keep illnesses at bay. Additionally, apples have been linked to improved gut health. The fiber acts as a prebiotic, feeding the beneficial bacteria in the digestive system. A healthy gut flora plays a vital role in digestion, nutrient absorption, and even immune function. For seniors, maintaining a balanced gut microbiome can reduce issues like constipation and improve overall well-being. Some studies suggest that the gut-brain connection means a healthy digestive system may also support mental clarity and mood regulation, which become increasingly important as people age. Apples are also low in calories but high in water content, making them filling without contributing to unwanted weight gain. This quality can be particularly helpful for seniors looking to manage their weight or maintain a healthy appetite. Since weight management impacts many aspects of health, such as blood pressure, cholesterol, and joint stress, apples become a practical and enjoyable part of a senior's diet. The familiar crispness and refreshing taste of apples make them an easy, satisfying snack for seniors. Unlike processed sweets, apples provide natural sweetness along with nutrition that helps keep the body strong and the immune system ready to fight off infections. Doctors often remind patients that eating whole fruits like apples rather than drinking fruit juices maximizes these benefits because the fiber remains intact and sugar absorption is slower. Incorporating apples into daily meals or snacks can be a simple way for seniors to promote digestive health, stabilize blood sugar, and support their immune system naturally. This crisp, grounding fruit truly lives up to the old saying, "An apple a day can help keep the doctor away," especially when eaten with care and attention to its skin and fiber content. Thank you for watching and taking a step toward better health after 65. Remember, the fruits you choose can either support your strength and vitality or quietly work against you. Make smart choices, listen to your body, and treat it with the care it deserves. If this video helped you, please like, share, and subscribe to stay connected with more trusted tips for living stronger and happier every day. Your health journey matters, and it's never too late to nourish yourself right. Take care, and see you in the next video.